Which part of the joint secretes synovial fluid? Option A, articular cartilage. Option B, synovial membrane. Option C, joint capsule. Option D, ligament. The correct answer is option B, synovial membrane. The inner synovial layer produces lubricating synovial fluid for smooth movement. Normal tidal volume in adult is option A 50 to 100 ml, option B 300 to 500 ml, option C 1 to 2 liters, option D 3 to 4 liters. The correct answer is option B 300 to 500 ml. Tidal volume is the amount of air inhaled or exhaled in normal breath. Which gland is called the master gland? Option A thyroid gland, option B adrenal gland, option C pituitary gland, option D pineal gland. The correct answer is option C pituitary. The pituitary controls several other glands, hence termed the master endocrine gland. The pituitary controls several other glands functions, hence termed the master endocrine gland. Where are red blood cells produced in adults? Option A liver, option B spleen, option C bone marrow, option D kidney. The correct answer is option C bone marrow. Red bone marrow of long and flat bones performs hemopoiesis. Red bone marrow of long and flat bones performs hemopoiesis. Which valve prevents black flow of blood from the left ventricle to left atrium? The correct option A tricuspid valve, option B mitral valve, option C aortic valve, option D pulmonary valve. The correct answer is option B mitral valve or bicuspid valve. This valve ensures one-way blood flow between left atrium and left ventricle. Which layer of skin contains blood vessels and nerves? Option A epidermis, option B dermis, option C stratum corneum, option D hypodermis. The correct answer is option D B dermis. The dermis supplies the skin with nutrients and sensory nerve endings. Which part of the ear is responsible for hearing? Option A pinna, option B ossicles, option C cochlea, option D semicircular canals. The correct answer is option C cochlea. Hair cells in the cochlea convert sound vibrations into nerve impulses. Which cell mediated immunity? Option A B lymphocytes, option B T lymphocytes, option C neutrophils, option D platelets. The correct answer is option B T lymphocytes. T lymphocyte or T cells destroy infected cells and regulate immune responses. The function of hemoglobin is to option A fight infection, option B transport oxygen and carbon dioxide, option C clot blood, option D produce antibodies. The correct answer is option B transport oxygen and carbon dioxide. Hemoglobin binds oxygen in the lungs and releases it to tissues, carries some carbon dioxide back. Deficiency of vitamin D causes option A night blindness, option B beriberi, option C scurvy, option D rickets. The correct answer is option C scurvy. Lack of vitamin C impairs collagen synthesis, causing bleeding gums and poor wound healing. Which part of the brain controls vital functions like respiration and heart rate? Option A pulse and medulla, option B cerebrum, option C cerebellum, option D hippocampus. The correct answer is option A pulse and medulla. The medulla oblongata regulates cardiac, respiratory, and vasomotor centers. The main artery supplying the brain is option A femoral artery, option B internal carotid artery, option C coronary artery, option D renal artery. The correct answer is option B internal carotid artery. Internal carotid and vertebral arteries form the circle of Willis to supply the brain. Protein digestion begins in the option A mouth, option B stomach, option C small intestine, option D esophagus. The correct answer is option B stomach. Pepsin activated with gastric acid starts the breakdown of proteins. The test measuring average blood glucose for 2 to 3 months is option A fasting blood sugar, option B random blood sugar, option C HbA1c, option D OGTT. The correct answer is option C HbA1c. HbA1c shows long-term control of blood glucose in diabetic patients. It is also called glycosylated hemoglobin test. Gas exchange between blood and tissues occurs in option A arteries, option B arterioles, option C capillaries, option D veins. The correct answer is option C capillaries. Thin-walled capillaries allows diffusion of oxygen, nutrients, and waste products. Which hormone increases blood calcium level? Option A calcitonin, option B parathyroid hormone, option C insulin, option D aldosterone. The correct answer is option B parathyroid hormone. Parathyroid hormone stimulates bone resorption and renal calcium reabsorption. Structure connecting muscle to bone. Option A ligament, option B tendon, option C cartilage, option D fascia. The correct answer is option B tendon. Tendons transmit the force of muscle contraction to bones. The lymph nodes and spleen belongs to which system? Option A circulatory, option B lymphatic or immune, option C respiratory, option D endocrine. The correct answer is option B lymphatic or immune. They filter lymph and produce lymphocytes for body defense. Fatty waves on ECG indicates option A hypokalemia, option B hyperkalemia, option C hypocalcemia, option D hyponatremia. The correct answer is option B hypokalemia. Excess potassium in blood affects cardiac repolarization, producing tall T waves. The main function of the colon is option A, protein digestion, option B, water and electrolyte absorption, option C, fat absorption, option D, enzyme secretion. The correct answer is option B, water and electrolyte absorption. The colon absorbs remaining water and forms solid fecus. Which muscle type is involuntary and non-striated? Which muscle type is involuntary or non-striated? Option A, skeletal, option B, cardiac, option C, smooth, option D, tendinous. The correct answer is option C, smooth. Smooth muscles of the organs and vessels contract automatically without striations. The organ that stores glycogen is option A, kidney, option B, liver and muscles, option C, spleen, option D, lungs. The correct answer is option B, liver and muscles. Liver glycogen maintains blood sugar level, muscle glycogen fuels activity. The nerve controlling diaphragm contraction is option A, vagus nerve, option B, phrenic nerve, option C, accessory nerve, option D, hypoglossal. The correct answer is option B, phrenic nerve. C3, 4, 5, C3, C4, C5 keeps the diaphragm alive. Phrenic nerve originates from these roots. The organ secreting trypsin and amylase is option A, stomach, option B, liver, option C, pancreas, option D, gallbladder. The correct answer is option C, pancreas. The pancreas secretes digestive enzymes by proteins, carbohydrates, and fats. The blood pressure during ventricular contraction is option A, diastolic pressure, option B, mean arterial pressure, option C, systolic pressure, option D, pulse pressure. The correct answer is option C, systolic pressure. Systolic pressure is a peak pressure generated when the ventricles contract. Thank you all.